everything has got some history behind. You are 5th year student, you are going to be a doctor. I am also, once I was a student like you. So, I started my life to become a doctor, not by chance or not by accident, by choice. I became a doctor by choice. Again, I became urologist not by chance, not by accident, that is also by choice. And especially I am interested to treat urology patient, mainly prostate. Again, it is by choice. Today we are discussing one of our patient. As you see, there is one of our patient having problem with prostate. For you as a MBBS student, to pass your exam, you have to know the prostate as a whole, because it is a very common problem all over the world as well as in our country. To know the prostate as a MBBS student, as a 5th year student, why we will study this prostate? Why? As examining what is our need to know the prostate? That is the basic issue. Why we are giving our time? That means why we read the prostate. Number one, you have to pass the MBBS, basic need. That's why we are here. Number two, you will get written question from this prostate disease. That is another thing. Number three, long case you will get. Definitely, this is the case. Long case you will get in your examination. Long case you will get. That is another thing. That's why we are here, to read the patient and the prostate problem. Number four is specimen. You will get a specimen of prostate in your examination. And you will get X-ray. Some X-ray related to prostate you will get in your exam. Number, the operative surgery. Another section of your MBBS exam is operative surgery. There also you will face this prostate problem. And in one word, without prostate there is no way to pass MBBS exam. That is the reality. That's why we are today studying our patient with prostate problem. Now, problem with prostate. What are the problem with prostate? Problem, how many ways the prostate can create problem with human being? Number one is benign enlargement of the prostate. That is the commonest problem with prostate. Usually patients suffer from. Next is carcinoma prostate. That is the second commonest problem with prostate. And number three is inflammatory disease of the prostate. In broad headings, these are the three problems patients suffer from with these prostate diseases. And if we want to discuss, this is the diagrammatic representation, that is the body. That is the, if you cut the body, that you will see, that is the bladder, prostate, prostatic urethra, pubic bone, that is the rectum behind, and that is the cross section of the prostate in the dead body. And in front you will see there is the diagrammatic representation. Where it is situated? It is situated just at the base of the bladder, where the urethra is starting, encircling the commencement of the urethra. That is the area where prostate is situated. So, this prostate, if you see, it is a fibromusculoglandular organ. Three components are there: fibrous tissue, muscular tissue, and glandular tissue. And this comprises 50% is glandular tissue, 25% is fibrous tissue, and another 25% is muscular tissue. These are the three components comprising this gland. And if you go further, then you will see this gland has been classified by different authors in different ways to understand it clearly. that is the zonal distribution, peripheral zone, which is also called the cancerous zone. As we have already mentioned, cancer prostate is one of the disease prostate suffer from. So this peripheral zone, usually cancer occurs more in the peripheral zone, central zone and the transitional zone. If you see the picture, you will see that is the peripheral zone P and Z. Transitional zone, the zone which covers the urethra, surrounds the urethra, and the central zone. So transitional zone is the zone of BPH. Peripheral zone is the zone of malignancy, and transitional zone in between. That is the distribution, and this is the way of distribution to understand the total thing, the distribution of diseases. If anybody asks where the cancer, incidence of cancer of prostate more common, answer is peripheral zone. BPH is more common. Transitional zone, which encircles the urethra. As transitional zone BPH is more common, so when prostate enlarges, the portion surrounding the urethra, so obstructive features more. In case of malignancy, as it is in the peripheral zone, so obstructive feature is not that common. But transitional zone is surrounding the urethra. That's why transitional zone produces obstructive feature more than that of malignancy. That's why this prostate malignancy is called the silent killer of elderly males. It is called silent killer as because this prostate malignancy even can metastasize without any obstructive uropathy. That's why it is called silent killer of elderly males. And this glandular distribution, again, outer layer consists of external prostatic gland proper, and the inner layer is called the periurethral gland. This is where it has been distributed, the glandular pattern of the prostate gland. If you go further, you will see, to simplify the thing, with the advancement of the change, some change within the human body is inevitable. These changes in the life as age advances, vision changes. So some persons needs change of vision, some spec glasses is required. That is normal. Again, with the advancement of the stage, hair become black to grey. That is normal. It will normal with that advancement of the age, it will occur. And then again, with the advancement of the skin becomes wrinkled with the advancement of the age. So it is not a disease, it is the aging process. Same way, with the advancement of the age, prostate will get enlargement. That is not a disease itself. So if this enlargement causes obstruction of the flow, then it is a problem. But simply enlargement is not a disease. With the advancement of the life, normal changes is there, so prostate enlargement is among these normal changes. So if these changes causes obstruction, then it is a problem. That is the understanding. Simply enlargement of the prostate is not a disease. When it causes obstruction, then it creates some problem. That is the disease. That is the understanding. So if you see here, benign disease of the prostate due to hypertrophy and hyperplasia of the fibromuscular stroma and glandular elements, mainly affecting transitional zone that I have already mentioned, and about 70 to 80% it is the transitional zone. And if you see, this is the verumentanum. If you go from distal proximally, you will see the urethra, you will see the verumentanum and lateral lobes, right and left lateral lobes. And these two lateral lobes, and that is the prostatic urethra. And then you will go more proximally, you will see the bladder. So that is the endoscopic view of the prostatic urethra, two lateral lobes and the verumentanum. And the verumentanum is the guideline. That is the place where the external sphincter level. So normally we are continent. Continent means we can control the urine by external sphincter and internal sphincter. This is the external sphincter side where the verumentanum is the level, and internal sphincter is the bladder neck. So, when we go for operation, then this is the verumentanum is the guideline. We do not resect beyond this verumentanum. That is why it is the endoscopic view of the prostatic urethra, where we can see the two lateral lobes, right and left, and the verumentanum. If you go further, prevalence of this disease. If you see in autopsy, this is the prevalence, and clinical symptomatic prostate, again age 50 to 70, 70% and above 70, this is the distribution of the prostate, and it has been studied in this country, and this is study done by me, first in this country by me, how many elderly males suffer from this problem in this country, and this study done in one of the Upazila in Gazipur, and it has been documented that 39.5% of elderly males of this community suffers from enlargement of the prostate. 39.5% is a big amount of people in this country suffering from this enlarged prostate. That is the study done in this country, and that is the study protocol we use, that is the ambulance. We use this ambulance, and what is the etiology of the BPAs? Number one, the exact cause not known, what is the cause behind, but there are some hypotheses. It is multifactorial disease, many factors related to produce this problem, and endocrine control. Testosterone is the main cause. If testosterone is absent, no enlargement of the prostate. If in the boyhood, if testis is removed, the factory from where the testosterone develops, the person will not develop any BPAs or enlargement of the prostate. That is confirmed. So, it is endocrine control, and estrogen and androgen synergistic action, it creates some synergistic effect to go for enlargement of the prostate, and decreased autopsies of the cells of the prostate gland. That is also another hypothesis which helps in the enlargement of the prostate gland, and some genetic factor is also related in the prostate. And factors responsible for BPAs, one is age, presence of dihydrotestosterone, that is another thing, racial factor is related, genetic factors mentioned, and diabetes mellitus, hypertension, these are also factors related with this disease. And then what is the pathogenesis? Pathogenesis means how the problem arises. So, you see this is hyperplasia, hypertrophy and hyperplasia, enlargement of the prostate gland due to enlargement mainly the median lobe. When the median lobe enlarges, it blocks the urethra. So, when it blocks the urethra, urine cannot pass. So, it causes the flow is obstructed. So, flow of urine is blocked. So, urine is retained within the bladder. So, ultimately due to detention of the bladder, what will be there will be the back pressure, bladder will be distended, then the muscle bladder will undergo into overactive, then the muscle will undergo into hypertrophy, that is called detrosal muscle hypertrophy. That is the muscle bladder of the bladder muscle is called the detrosal muscle. Like if this biceps is exercised, biceps undergo hypertrophy, same way to overcome the obstruction, the detrosal muscle undergo into hypertrophy. When the muscle undergo into hypertrophy, in between the hypertrophied muscle, the mucosa becomes laxed, and the mucosa then it produces trabeculation. Then trabeculation when more distended, then there is diverticulum formation. Ultimately detrosal failure will be there, then bladder will not be able to contract, then that is called detrosal failure. So, there will be chronic retention, that is the pathogenesis, that is the back pressure. Ultimately the pressure will be reflected to the ureter, there will be hydroureteronephrosis, ultimately there will be renal failure. So, many a time we get patient with long lasting BPAs, not taken any care, patient may present with bilateral hydroureteronephrosis.